Now that we've looked at why you probably shouldn't lift a keg, let's look at what happens to your body when you actually do lift a keg. For this section, we're going to be borrowing very heavily from the notes and slides of Dr. Emily King. Dr. King is a specialist on body mechanics in the workplace. Her particular focus is on healthcare workers and how their bodies are loaded when they move patients. More recently, we've collaborated on ergonomics in craft breweries. And everything we're looking at today is all cumulative loading. So it's the tasks you do repeatedly, not necessarily things that hurt you right away, but things that will hurt you over time. Acute loading and acute injury is a different thing, and that's sort of when your body goes pop, right? You'll notice these damages more sort of right away, and they'll hurt a lot. Acute injuries will sort of send you to the hospital the same day, whereas cumulative loading and cumulative injury, that sends you to the physiotherapist more sort of long term. This is a good depiction of the structure of the spine. We won't get too bogged down in details, but it's important to look at the disc portion. It acts as shock absorbers and allows for movement between the vertebrae. While damage to the vertebrae can be a cause of back pain, most of the back pain associated with long-term lifting and body loading actually comes from the squishy discs in the middle. Here we have listed many of the causes of chronic low back pain. They can include osteoarthritis, the degeneration of intervertebral discs, which is the point I'd like to focus on, as well as disc herniation, vertebral fracture, and the last point refers to the fact that pain is a psychosocial phenomenon, and the way your back relates to your work and your perceived function in society very much impacts how your back pain will present. In the past, when we've looked at safe working limits for lifting, we thought that the model looked more or less like this, that the load could be of a certain magnitude, your day of work would be of indeterminate length, and that there was just a safe limit that you could lift beyond which you would injure yourself. Our best new research has led us to realize that the previous model was not accurate. We now know that as the workday continues, your safe lifting limit actually decreases. A load that was safe to lift in the morning may not be safe to lift by the time you're ready to go home. This change in safe limits over the course of a workday is where a lot of injuries actually develop. The way we divide work in the modern-day brewery does not reflect this reality. Long workdays are very common, and we do not relegate the lifting tasks to the early part of the day only. They unfortunately must be spread throughout. This is a quick summary of what happens to your body during loading, and this will be where a lot of your pain actually comes from. As you start moving around and start loading your body, your ligaments will start to stretch, and as they stretch, they'll get some micro tears. Those micro tears will lead to inflammation. Both the stretch of the ligaments and the inflammation will lead to your discs having more mobility overall. The greater freedom of movement of the discs of the spine leads to an inherent instability. Now, the way your body reacts to spinal instability is often at a subconscious level. Your body rates very, very highly the protection of the spine. And so, when it's presented with spinal instability, especially under heavy loading, it reacts with muscular hyperexcitability. Without stiff ligaments to control the spinal instability, the body turns to muscular hyperexcitability as its only course of action to stabilize the spine. Now, muscular hyperexcitability means the muscles are working sort of extra hard, extra fast, and it leads to a feeling of something a bit twitchy, if you will. That extra hard work of the muscles results in a squeeze, and that squeeze leads to intervertebral disc compression. Now, once those discs are squeezed, you actually have once again more space for the discs to move. Now, if you stop working or stop, exercising or whatever you're doing that's causing all this activity and give your body time to recover, that's great. okay? Your body recovers and you can kind of go back to normal. But if you keep working, if you keep pushing on it, well, what happens is your ligaments keep stretching, you get even more instability, even more muscular hyperexcitability, and then even more intervertebral disc compression. And unfortunately, there's even more bad news. As you age, your safe lifting limit also decreases. So the same load that was safe for you to lift at 25 may no longer be safe for you to lift at 35, 45, or 50. And this runs contrary to the way our typical sort of hiring and ethos works. We view a job as a job and any employee as capable. However, the reality is we may be doing damage to those employees whether we intend to or not. As you may have guessed from the happy face, this represents a happy spine, a healthy spine, one that's not going to cause someone much pain. And what we see here is the discs have a freedom of movement up and down permitted to them by the ligaments, the muscles, and the intervertebral discs, the squishy bits in the middle. It's also important to note that the intervertebral discs are not static features. They're living tissue that helps communicate fluids as well as nervous signals from the spinal column and into the discs themselves. Damage to the surface of the discs inhibits their ability to remove wastes and to supply fresh fluids effectively. This inhibits the function of the discs of the spine. If we were to look at a living person's spine while they were working and moving, we might see the intervertebral disc look like this gray slab on the right. And eventually, as we're working and moving or exercising, we will do a small amount of damage to this disc, as represented by the red mark here. This is a small amount of scarred over area that won't behave like the rest of the tissue. Given enough time and rest, the small amounts of damage will heal. However, what is more typical is that we continue working and loading our bodies past our safe working limits. This contributes to additional damage to the tissue. A lack of recovery time after excessive damage leads to negative consequences. Eventually, damage upon damage leads to scarring over of the intervertebral disc surfaces. It's important to note as well that the damage already done leads to further damage being more likely because it increases the load on those parts of the body we haven't already abused. And the issue overall is not exactly the physical impact of the disc damage itself. That's not what's leading to the pain. It's the fluid issues that result from that scarring. Okay? It's the inability of the body to effectively transmit fluids and properly do its sort of waste cleanup in those areas. Scar tissue built up along the interior surface of the intervertebral disc leads to an inability to allow fluids to escape the disc and enter into the membrane, and vice versa. This leads to a lack of movement between the discs and an overall stiffening of the region. It also generally leads to more pain. By the time you've reached the point of significant scarring to the point of disc damage, your days working in that position are going to be numbered, as the length of time it will take you to recover may be prohibitive to you continuing the employment. These diagrams exaggerate the forces on an intervertebral disc to better illustrate the forces at play. What we have in normal loading is basically the weight of your body in an unloaded position. When we have compressive loading on the spine, this is often from when we are lifting something or bending and putting a squeezing force on the intervertebral disc. We also see damage occurring from uneven loading where we have forces going side to side. This is evidenced by the sort of exaggerated bulge we see here. We also see damage coming from twisting motions, and that is the torsion type of loading. We will be looking at some of the compressive loadings as we look at lifting kegs in our analyses going forward. Now that we're armed with a little bit of knowledge as to how the spine is loaded, how injury occurs in the workplace, and how breweries are run differently now than they used to be, I think we can go back to examine some of the questions we asked earlier. So we know that in the past, brewers used to operate as a trade with novices through to masters represented in a single brewery, making them generational workplaces. And based on what our best research shows, we now know that our ability to lift safely decreases with age. So likely, in our past breweries, we are going to have significant lifting tasks separated between the different individuals on the job based probably on their age, among other things. When we're looking at a situation where we have more individuals per liter of beer who are going to be required to do the physical work of the brewery, we have more hands being available to do and share work. Solo lifts are less likely, and it's also more likely to have people spelling each other off so that the same worker isn't doing the same task all day long. And we know that reducing the frequency of the problematic lifts is key to reducing the lifelong injuries. So by reducing the number of solo lifts and increasing the amount of spelling off we might do, we're going to reduce the amount of recovery time we need between times we damage our spine severely. And to the last point here, while we have brewing being a hard craft, we have competition taking more time. More people with a lower production rate over a longer period means that there's simply less rush, more time to recover, and the number of permanent injuries we're going to do is going to be reduced for that reason.